Illegal Drugs and Their Effects on Athletes by Brownsville Veterans Memorial High School Trainers by Kaya Trevino, Lissandra Mireles, Denise Arreola, and Fernanda Garcia. Why do athletes use drugs? Athletes know that training is a very important part to victory, and sometimes they think that using drugs will help them to get ahead, but they are wrong. What about these drugs? In these slides, we will ignite your knowledge and awareness about these drugs and their effects. We will show you different examples and their specific effects on athletes. Cannabis, also known as weed, grass, pot, herb, and ganja. Well-known athletes that use marijuana are Stephanie Lee, Michael Phelps, Jerome Simpson, Elijah Dukes, Jordan Schaefer, and Mario Chalmers. NCAA concludes that 22.6% of their athletes smoke marijuana. Effects of marijuana: euphoria, relaxation, audiovisual illusions, red eyes, increased appetite. Hypotension may occur from smoking marijuana. Cocaine. Most athletes think that cocaine is a performance enhancer and will improve their performance. But will it? No. Cocaine increases alertness, which worsens the endurance tests that they take on a regular basis. Anabolics, the effects of cocaine, from respiratory problems, strokes, seizures, nausea, fever, mood disturbances, damage of optic nerves. Fatalities. Athletes that have died due to cocaine include Leonardo Baez, a professional wrestler, Darryl Porter, baseball player, David Waymer, football player, Reggie Lewis, basketball player. Anabolic steroids increase muscle mass and decrease body fat, and illegal anabolic steroids are 10 to 100% worse than those prescribed by a doctor. Effects of anabolic steroids. Effects on men include decrease in sperm count, decrease of shrinking testicles, and enlarged breasts, while in women are decrease in breast, deepening of the voice, and increased body hair. Ecstasy. MDMA, also known as ecstasy, acts as a stimulant that also has mild psychedelic properties. Users experience a sense of euphoria and well-being, a boost in energy, along with other effects, such as depression, irritability, fatigue, gastrointestinal problems such as diarrhea or constipation, muscle and joint aches and pains. Do you know Molly? Molly is composed of MDMA. MDMA is a synthetic drug, meaning that it's made of chemicals. It also includes bits of ecstasy, meth, and other drugs. Typical effects of Molly: basic and subjective change in consciousness, powerful sense of self-acceptance, diminish of fear and insecurity, feeling of love, compassion, empathy, and self-confidence. LSD is mainly called LSD or acid. Is used as a hallucinogenic and started in the mid-1950s, at first used by psychiatrists and then made it into the real world. LSD effects: increased blood pressure, heart rate, dizziness, sweating, nausea. Unpredictable effects on the mind, dramatic effects on the senses. Trips usually last 8 to 12 days but can last for days. Meth is highly addictive and very toxic to the brain. It treats for ADHD and for weight loss for obese people. Meth effects: increased wakefulness, decreased appetite, hypothermia, mood disturbances, delusions and paranoia, even homicidal and suicidal thoughts. Athletes and drugs overall. Athletes know that they should not take drugs. If they do, it will mess up their game on and off the field. No matter what they do, drugs will mess them up. The end. The VMHS Student Athletic Trainers would like to thank you for tuning in. Your awareness on illegal drugs and their effects has now been VATAIGNITE.
Con los terroristas.
And do the Harlem Shake.